The specific new medicines for hepatitis C that had brought about this revolution in the treatment with for hepatitis C associated with nearly 100% cure rates include sofosbuvir, ledipasvir, paritaprevir, ombitazvir, cimeprevir. And also very exciting are the likely approvals within the next 6 months of daclatasvir and grazeprevir and elbasvir, so that the clinicians will have a full repertoire of different programs of treatment, all of them with exceedingly high cure rates for hepatitis C. Well, the impact of the new treatments for hepatitis C in my practice, and in fact in most liver practices, has been enormous. We now have the opportunity to cure the vast majority of patients, and there are very few diseases in medicine where we can use the word cure. The new agents for hepatitis C are able to cure most of the genotypes that infect patients in the United States. There are approximately 8 genotypes which are variants of the hepatitis C virus, closely related but also with some distinctive characteristics. So the new treatments are used in a slightly different way for the different genotypes, with different medicines and for different durations. In essence, all the major genotypes that occur in the United States are well treated with the present new drugs. In the US, the most common genotype is genotype 1, which can be subdivided in genotype 1A and 1B, but there is approximately 20 to 30% of patients with hepatitis C that are infected with genotype 2 and genotype 3 in the United States. The different new agents for hepatitis C, for instance, that are used against genotype 1 include ledipasvir, sofosbuvir, paritaprevir, daclatasvir, dasafovir, and ritonavir. For genotype 2, the optimal treatment these days includes the new agent sofosbuvir plus ribavirin for 12 weeks. And for genotype 3, the most common treatment with the new agents these days includes sofosbuvir plus ribavirin for 24 weeks. But nonetheless, because the genotype 3 is still a genotype that we can only cure in 60 to 80% of the cases, there is active research in finding better treatments for this particular genotype. And some of these treatments actually still include interferon, although this is a very active area of research at this point. The new agents for hepatitis C are used every day by the patient. The patient takes 1, 2, or up to 6 pills a day. The duration varies anywhere from 8 weeks to 24 weeks, depending on the genotype and whether the patient has ever been treated before or is a patient that we call naive to treatment, meaning that has never been treated before. Once a patient achieves a cure with one of these treatments, there is no need to do a second treatment. The patient is cured. Yes, like with any medical treatment, there are some side effects, and some of these side effects include fatigue, headache, insomnia, but the frequency of the side effects and the intensity of side effects are dramatically less than the interferon-based treatments that we use for so many years. In most patients, the interferon treatments were very hard, characterized by many adverse events, multiple side effects that made this treatment with interferon very difficult, I would say, in maybe 90% of patients. Of course, there was a small number of persons who tolerated the interferon very well. But for the vast majority, it was a very difficult medication to use via injections for 1 year or sometimes even longer than a year. Interferon is still a consideration in a very small number of patients. For instance, for a patient with genotype 3 and cirrhosis who has no other conditions, we need to discuss the possibility of using the new agents such as sofosbuvir in combination with interferon to achieve cure rates in the order of 80%. But there is still very much research going on to try to eliminate interferon altogether. No, the interferon in combination with the new agents produces the interferon side effects plus the minor side effects of the new agent.